Recording.
Yes.
Hi, my name is Jamie, student physical therapist assistant. How are you doing today?
I'm doing all right.
All right, we're going to work on some of that congestion in the lungs.
Okay.
I noticed your chart, you've had some pain in the sides and a little bit on your back. How would you rate that pain for me today? 0 to 10, 0 no pain, 10 significant pain.
It's probably like a 4 today.
A 4 today. Okay. So I'm going to take a listen. Listen for those sounds that we tend to hear when there is fluid that needs to come out.
Okay.
And then I'm going to start to instruct you through some positions, both here and what you can do at home. A lot of these you can just do right at home, and some of them are a little tricky. And then there's going to be some percussive techniques that help sort of dislodge that stuff that's stuck in there.
Okay.
We'll work on some breathing techniques that you can take at home, and also some positions for that shortness of breath.
Okay. Excellent.
Any questions before we get started?
I don't think so.
All right. So first, I'd like to have a listen.
Okay.
Yep. You can lift your shirt, please.
Sure.
Thank you. Can you breathe in for me? Again in. Side. Breathe in. One more, please. All right. Let it listen on the back. So again, breathe in.
Okay.
And out. Another breath in. One more time. Good. In. Very good. All right. Certainly hearing those sounds, those crackles.
Okay.
So that's definitely a sign that that stuff's still in there. So let's begin our positioning today.
Okay.
We'll lie stomach down on your stomach, head
Okay.
this way, feet this way.
Okay.
Hang on to that. You don't need that quite yet. Slip this pillow under your hips. Thank you. All right. Just cradle your head with your arms there. You can
Okay.
lie your head down one way or the other. All right, we're in that prime position now to start moving that fluid downward. So I just want you to breathe normally, and I'm going to apply some cupping here. Just some gentle cupping. So the intention here is, again, to dislodge that material. Keep breathing normally. I'm going to apply a slightly different technique on the next breath or two. I'm going to have you breathe in. And on the exhale, I'm going to apply a little vibration.
You know, I think I may need to get up for a little bit.
Difficulty breathing? All right, I was afraid of that. All right, let's go ahead and come on up to seated.
Okay.
Roll over.
I think I just need to
Not
sit
too
up or
quickly.
something.
Yep, you got it. I'm going to bring this up behind you. And kind of just lean right back into it.
Okay.
Go behind your head. You might take your hands up behind your head, elbows bent. Open up the chest a bit more. Let that breath in. Take your time.
Okay. Okay, I think I'm okay.
Okay. So lying on the stomach can make it difficult to breathe. So let's change position here. Go ahead and sit up the rest of the way.
Okay.
I'm going to lower this back down. All right. For this next position, I'd like to have your head here and your feet here,
Okay.
lying on your side.
Okay.
This one is really going to encourage some movement through that fluid.
Okay.
So I'm going to give you a cup. We're actually going to work our way toward a cough here.
Okay.
So I'm going to position the bed slightly up at your feet. Your head will be lower than your feet. I'm going to do those same percussive techniques. We're going to add a little, it's called huffing.
Okay.
So we'll breathe in, and as we breathe out, it's kind of like
Okay.
that just encourages more of that stuff to come up.
Okay.
Okay?
Sounds
And
good.
you'll start to feel it. You'll be ready when the or with the cup.
All right. Yep. Don't want to cough up on your floor.
You don't want that. You want to cough up on yourself. begin to feel a little awkward.
Okay.
All right. Breathe in and out. Just normal breathing. I'm going to begin to apply that percussion. Take about 3 more breaths here. All right, on this next one, I'd like you to breathe in. And on the exhale, I'm going to apply that vibration. Good. 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 Let's try a different one here. Breathe in. Exhale. I'm going to give you kind of, it's going to feel like shaking a little bit.
Okay.
Good. I hear that huffing. Good.
Yeah.
Yeah. All right. Okay. So we're going to change positions.
Okay.
We're just going to roll right over to the opposite side.
Okay.
So it's the same exact position. We're just going to get that opposite long. Got your cup?
I got it.
All right. Just breathe normal here, in and out. All right, breathe in. Exhale. I'm going to apply that vibration. Inhale, exhale, little vibration. Huff. Good.
All right.
Feeling good?
Mm-hmm.
All right, I'm going to lower you down.
Okay.
There we go. Bring your legs over. Come on up. Morning. All right, so there's a few more techniques we're going to teach you, some of those postures and breathing techniques you can do at home.
Okay.
Seth will be in here to do that with you.
Okay.
Any questions for me before I go?
Nope.
All right, have a wonderful day.
Thank you. Hey, Jamie.
Hi.
My name is Seth. I'm your second therapist today.
Okay, yeah.
The other therapist had to leave a bit early, so I'm just going to be kind of picking up where she left off. We're going to be doing some breathing exercises.
Okay.
So I'm just going to kind of teach you what to do in your short of breath, some positions that you can use to help get some more airflow.
Okay.
And then secondly, I'm just going to teach you some breathing exercises called diaphragmatic breathing. So there's a muscle basically beneath our lungs. It's the primary breathing muscle.
Okay.
And so I'm going to teach you how to strengthen that muscle and use it so that can get stronger over time, so that with your condition you can maybe get a better cough and also just practice relaxation.
Okay.
Sound good?
Yeah.
Okay, so first I'll just have you lay on your back. Now this is a fairly simple thing, but it really will help. First, with diaphragmatic breathing, we like to teach what's called pursed lip breathing. So what you'll do is inhale through your nose for 2 seconds, and then I want you to breathe through your mouth when you exhale for 4 seconds. So we like to call it smelling the rose and flickering the candle. So go ahead and try that. 2 seconds in, and 4 seconds out of your mouth. And in through your mouth. Or in through your nose, sorry, and out through your mouth. Good. Excellent. Now while you're doing that, you put your hand on your belly here, and your other hand over your chest. And what you do is what's called belly breathing. So you can kind of pretend there's a balloon in your belly and like we're blowing it up. I want you to, when you take a deep breath in, only use your belly, and your belly should be moving up, and you shouldn't feel any movement with that hand on your chest.
Okay.
So up and out. Just that belly should be moving. Let's do that like 3 times and see how you feel. One more. That's good. And I can notice you're breathing in through your nose, out through your mouth. Excellent. So you can practice that at home. It'll just strengthen that diaphragm muscle and help you relax, along with lots of other good benefits. Okay. Secondly, I'd like to show you some positions you can get in if you're short of breath.
Okay.
Okay. So you can sit up for me.
I'm feeling a little short.
Okay. Yeah. If you're feeling short of breath now, this is a perfect time to practice this. So actually, if you would have a seat on this chair here. Whenever you're short of breath, it's pretty easy, but just put your hands up on something, like a table or a chair. Here we got a plinth, and open up those air lung passages like that. How does that feel?
Yeah, it feels better.
Good. Excellent. You can do the same thing in standing. Try standing up for me. And do the same thing. Just kind of hands on there. Open up that lung passage. Excellent. And that deep breathing that we just showed you. If you have a little more time and you have some pillows, you can actually use pillows as well. If you sit back down, just grab a couple pillows from home or something, and you can kind of lean over them and put your arm up over your head, and then your other arm, yep, and kind of out to the side, yep, excellent. So if you're ever feeling short of breath, that's a great position to help relieve that. Okay, and I don't know if Jamie mentioned, but also when you're doing those positions, she probably already told you, but when you're doing those positions for postural drainage, where you're sitting there for 15 to 30 minutes, make sure you do those at home. You can do them, all the 3 positions I believe that were showed you. One is on your belly, obviously you're just laying on a bed, putting a pillow underneath your pelvic area, and then you probably need a lot of pillows. You might actually get a couch cushion for the other 2 positions, so you can kind of put your legs and feet up on something like that so that your head is down more without a pillow even. And practice sitting there for 15 to 30 minutes and then doing that coughing as well at home. So basically that's just kind of a general overview of some breathing techniques, positions, and things that you can do at home to relieve that. Before you leave, I'd actually like to take your oxygen saturation levels just to see where you're at after we've done treatment. So let me put a little thing, got in my pocket here. All right. Okay, it looks like you're at about 94. That's not bad. That's really good actually for where you've been at. So it was great working with you. Did you have any other questions?
I think so.
Okay, awesome, Jamie.
Thank you.
Have a good day.